we are going to make a carving to upper canine. So regarding to the previous lab instruction, we will adopt the cutting rules according to the principle to perform the outlines of the canine. So what I need now, I need a block of wax. It will be need to assign the length of the crown. The length of the crown for canine is 10 millimeters only. You can add the new millimeters for a cemento animal objection if you need, but you can perform with the 10 millimeters. So I will start with the 10 millimeters to assign the length of the crown. This is 10 millimeters. Now I put it in the block and I assign the length of the crown. So the length of the crown, it will be ended by this line. So regarding to our rules, I need to make a bisecting line and I need to make a third here. You can see this is the length of the crown. It will be assigned here. Okay, this is for regarding to the length of the crown. And this is the lines. It will represent the area I needed for the whole crown. So after that, if you want to make a root here, you can assign it now. But our objective to make a bisecting line here and divided this area into 3/3. Okay. So regarding to the 10 millimeters, if I want to divide it to 3 divisions, I need 3 point. You can make it 3.25. Okay, 0.25. Okay. So you can use a measurement to assign that. This is 1, 2, 3. This is for 1/3. I will assign here to represent the cervical third. This is the cervical third. Make it horizontal and parallel to the first one. On the other third, it will be represent the middle third. Put the block and assign the another one. It will be located here. So we have 3 equal thirds. Okay. Just I need to make a bisecting line in the midline. You can depend it upon the measurement from 2 sides if you want. So you can, as well as you can make it by estimation. So this is my labial aspect. It will represent the first cutting. So our objective now to make a cutting to the labial aspect. Okay, regarding to the measurement and regarding to the shape. So I would start with the labial aspect as well as the lingual aspect. It will be produced automatically. Okay, so this line you can make it around the block and you can make all thirds because we have one measurement. Now I need to make what? I need to make the measurement. You can see we, as mentioned in the previous lab, we will adopt the shape and the measurement. To be in particular descriptions, I need the proportion, okay? So the our proportion, it will be depend upon the measurement that will be mentioned in the reference. So I need from the labial aspect, so I need the mesiodistal diameter, okay? The mesiodistal diameter of whole crown, it will have 7.5. The mesiodistal diameter of the crown and the cervical, it will be 5.5. So I will start from the cervical third. I need to assign this measurement regarding to the midline. 5.5. Where is it? Where the dot, it will be located at the cervical. There is no contact area. There is a minimum width and the maximum width. The minimum width, it will be located here, 5.5. You can make it 6 millimeters to release somehow of wax for carving. Okay, you can assign it 6 millimeters. That means I need 3 millimeters to each side. So 1, 2. Yes, I need 3 millimeters to each side on the cervical thread. This 1, 2, 3. This is my bisecting line. So I need the minimum width of the crown. It will be located here at the labial aspect. And so I need to make 3 millimeters, or this is done, this measurement, to assign the minimum width of the crown. So this is the 2 dots will be located here to assign the minimum width of the crown at the cervical thread. Okay. So what I need now, I need the other one. It will be 7.5. You can make it 8. I will remove it by the carving or roundation. So I need 4 millimeters to each side. But here, please, be attention, because where is the contact area? Because this is a minimum width for the cervical. This is good. The task is accomplished. But for whole of the crown, there is no one parallel to other. I need to assign where is the maximum convexity, where is the maximum width, because we don't have one line for this width. Okay, so one of these, it will be located at the junction of the middle and the incisal third. Which one? It will be mesial or distal? Between the junction between the middle and the incisal third. No, please. Mesial. Because from the mesial, it will be located in this third. When I reach to the distal, it will be converted to the middle third. Okay, I need one at the junction of the middle and the incisal third. The other one, it will be located where? In the what? In the middle of the middle third, regarding to the distal aspect. Regarding to the distal aspect. Let me make a check here. You can see it now. This is for the mesial. This is for the distal. Because we have a contact area within the lateral, so we need a contact area within the posterior teeth. You can see it will be declined. It will be decreased in level. Yes, because we have a posterior. The posterior, it will be where we have a contact with the posterior teeth. So the contact area will be decreased. Okay. So this contact area, it will be impact the shape. So this as to make these dots or this reference upon the block. So now I assign my mesial. If you want to make that mesial, this is a mesial, and this is a distal. The maximum width we have 7.5. You can make it 8. This is 5, 6, 7, 8. This is the mesial. It will be located at what? No, junction between the. Yes. Where's the junction? This is the junction. This is the incisal third. This is the middle third, and we have a cervical third. So from the mesial, it will be toward the incisor. It's not toward the cervical. Okay, it will be in the top. So this is the position of the contact area. It will be located here. We have a maximum convexity. It will represent the contact area from the mesial aspect. So I need to assign 4 millimeters. 1, 2, 3, 4. Because we have two aspects, and the 8 millimeter, it will be divided into two measurements for each side. So other contact area will be located here. This is from the mesial. Regarding to the distal, I need it in what? In the middle of the middle third. You can see, make a revision here. Yes, this is in the middle of the middle third. This is a middle third. The other contact area from the distal aspect, it will be located at the middle of the middle third. So it's very easy to assign this contact area of this maximum convexity in the middle of the middle third. It will be located here. So you can see we had 0.5 more than the original measurement. There's no blame for that. I can make a management within the roundation. But be sure this increase, it will be not impact the proportion. Okay? So how about the cuspid, where it will be located at what? At the labial or the lingual? The tip of the cusp. Let me check. Lingual or where is the cuspid? Regarding to the cuspid. Labial. But lingual or labial? No, lingual. Which one is very? May had a complex information of about the tip of the canine. Okay, it will be in the labial or in the lingual. Don't pay attention to this task, because just I need to assign appropriate measurement for this tip. To be sure the tip of the cusp, it will be construct the incisal edge, because when I have an inclination in the tip of the cusp, I will construct the another incisal edge at this margin. My recommendation, don't pay attention about this measurement in the top. Just put it in the center, or you can make it toward lingually, because we have a convexity in the labial margin. After that, without measurement, after that, just make the incisal edge at the cusp. Okay? So why I will assign the accurate position of the tips to perform the incisal edge, because we don't have edge. This is a cusp tip. As well as we need to make a slope of the edge. So make it with a carving. Okay? This is my recommendation. If you want to assign, you can make it 1 millimeter and will be degrees 0.5. But my recommendation, this is a complex information for the beginner. So just make a slopes with the edge. Okay? So regarding to the tip of the cusp, you can assign another way, because regarding to the slopes. Okay, regarding to the slopes. So this is the mesial and this is the distal. Okay, you can make it in the center, and you can make another reduction to assign these slopes. If you want to make it within the first stage, you can make it within the slopes. The mesial slopes, it will be shorter than the distal slope. That's right or what? Or not? This is the mesial aspect. So the mesial aspect, we have a slopes is shorter than the distal. So the top, it will be located here, because I want to make what? Sorry. It will be located here because I want to make a longer slopes to the distal. What I mean, this is the mesial. This is the mesial. We have this slope, okay? This is the tip of the canine, and we have a long slope here. That mean the tip, it will be located in the mesial. I will make it toward the mesial. If you want to make it with the measurement, you can make it 1 millimeter. If you don't need to make a measurement, just keep slope here longer than the other side. Okay? You can elect the appropriate technique for you. My aspiration is that to perform the two slopes. One mesial, it will be shorter than the other one. Okay? So this is the one technique. If you want to make a whole descriptions of the outline of the canine from the labial surface by drawing, it will be clarified. So this is not a complex information to, it will take it easy because I will add the longer slope than another one. If you want, don't make it with the first stage, okay? This is my recommendation for the beginner, okay? So this is the contact area from the mesial. This is the contact area from the distal. This is the minimum width. So we have the maximum width. What I need now? Just assign the shape. Okay? Regarding to the outline of the canine. Where is the concavity? Where is the convex? Where is the maximum convexity? Where is the... we have a curvature here where there is no straight line in the teeth. You can make evaluation to this chart. What we need now, do we have a slightly convex here? Okay? It's not straight. Slightly convex, yani you can say it's not straight, but not very convex. Okay? We have a maximum convexity here. We have a long slope here. And so we have a tip of the canine here. It will be located in this part because we have two faces in the canine. We have a slope here. We have a concavity here. This is just only slightly concave at this portion. This is very essential. Why this concavity it will be produced? Because we have a bulgy area at contact. It will be what? It will be result in this concave. Okay? So let's assign it now. It's very easy to assign the outline of the canine. I will start from the mesial. This is slightly concave here. So you can add the features in the carving, okay? But don't make it straight. Put it in your mind. There is a concavity and convexity in this line, okay? And we have, sorry, this is the distal. So we have a long slope here, and we have a short slope here. It will be this concave. It will be this slightly convex. Okay, and this is the tip of the cuspid. Okay. So my recommendation just to preserve the proportion now. Okay, don't pay attention to that. It will be not clarified now. After cutting, I will add the concavity and convexity if I need it. Okay. My recommendation, it will maintain the minimum width and the maximum width. Okay. And the position of the tip of the cusp regarding to the what? Regarding to the length. If you want to add an advanced feature, you can make it this slightly concave. And you can, we had a long slope here, so from the distal, and we have a short slope here, and we have a slightly convexity here. Okay? So what I need now? Cutting. I need to make a cutting. So regarding to the instructions of the cutting from the labial side, it should be produced the other side. So start to make a cutting by slicing. Please, for you, don't to avoid the time consumption, to avoid the waste of the time, I will use this sharp edge. Don't use it. Use a lacron or wax knife or any tools to make a gentle slicing. Okay. Please, when make a cutting, please make a support to the block to avoid the mistake or a break to the cusp. You can see what I want to make. I want to make this shape here. It will be produced. The maximum convex, the maximum curvature at the mesial and the distal. To represent the line, I need the slopes here. So this is my objective now. You can see this is the bulgy area. It will be located in the middle of the middle third. We have a long slope here. So this is what I need now to make it now. Just make a cutting to represent the initial outline of the canine. But please preserve the measurement because this is a critical measurement now. Don't exceed. Just make it with your drawing and your assigned line. You can make initial cutting from away from the lines and added final cutting within the Lacron carver. Please, when you make a cutting, don't make a straight line, just keeping within the shape, within the drawing. So please don't make the crown, don't increase the length of the crown. Assign the length of the crown at this stage. Okay, this is the length of the crown. Don't increase in the length because we already had at 10 millimeters. Now complete the cutting. It will be, if you want to make it concave, make it within this stage. If you wanted to make it with the carving in the further stage, you can. If you lose the management within the cutting, make it gradually. Don't make all steps with one stage. Just make a correct steps to avoid a mistake. This is to represent the contact area now, the distal. So this is my cutting here, but please the tip of the cusp, please maintain the tip of the cusp. This is the slopes. It will be represent the distal slopes. The distal slopes, it had a length more than the mesial. So this is the tip of the cusp. It will be produce the same curvature in the top of the block as well as to the lingual aspect. So when I make a cutting, please make a cutting to reform same shape as in labial aspect. It will be produced in this area. Okay, pay attention to the lingual. Okay, because we make a lingual, if you want to make a labial aspect, the lingual aspect should be produced automatically because we will adopt two faces now, from the labial and from the mesial or distal. So when I make a cutting in the one aspect, the other one, it will be produced automatically. By the way, yani. So just keep the removing and produce parallel surface here, okay? And avoid, make it shallow with the straight surface. Don't make any impingement or irregular surface at this stage, because we need this surface to make another measurement regarding to the distal or mesial aspect, to make the another face, to another aspect of the tooth. So this is the contact area. Make evaluation, make a double check when make a cutting. You can see this is this area more width here regarding to the labial aspect. Make a cutting, but if you need to make a tapering in the lingual, there is no blame about that because we already make a tapering. But my recommendation, don't put it in more mind to make that tapering now. Just keep going because we need it for measurement. Just keep going to make same line. It will be converted here in the top of the block, and it will be reflect the shape of the labial at the lingual aspect. This is our objective now. Don't pay attention to any advanced feature now. Just make an outline. Just make the outline now. Just make a cutting regarding to the shape. You can see this is the bulky area here. Remove it regarding to the shape. Keep this. I need this curve. I need this curvature, because this curvature, it represents the maximum width of the crown. Just please keep it straight. Don't make altering to the shape of this curving. Yes, because I need it for what? I need it from the lingual aspect. To make a contact area from the lingual aspect, to make a maximum convexity from the lingual aspect. The width of the canine, we have, what's the difference from the central or lateral regarding to the canine? In the central and lateral, we had one face, but unfortunately, in the canine, it's not difficult, but pay attention, we have two face. We will make it in the further stage. We will have two face in the canine. If you had a good experience with the canine, the premolars for upper and lower, it will be very easy for you. So the canine, it will be make initial experience to the posterior teeth regarding to the premolars, because we had not exactly, but initially we had a same aspect. We had two face, okay, because we have a central loops in the center. So this loop, it will be divided the tooth into two faces. So pay attention to the canine, because if you had experience with the canine, the premolars, it will be very easy for you, in particular from the buccal side, because the buccal side, regarding to the labial, regarding to the buccal aspect, had a same shape, somehow some shape in the canine. So just keep the angles and keep the measurement within the same shape, because I need it for the measurement. So this is my concavity here, slightly concave. Make it now if you want. Now you can make it not within the drawing the outline to avoid interference, okay? And this is the maximum convexity here. It will be represent the contact area from the distal, okay? I mean this area. So this is the straight or parallel surface, represent the slopes. It will be continuous to reach to the lingual surface. This is the tips of the cusp, and we had a short slope. You can see what's the benefit of the measurement for the tip of the cusp. My recommendation, just make two slopes. The short slopes, it will be located in the medial aspect, toward the medial. The long slope, it will be located toward the distal aspect. So don't make more information for you. Just make the more necessary one, more important one. Make your work very easy. Make it gradual, sequence steps. Don't make another one if you don't had a full sure for the correction, okay? So what I need now to make another slicing here to represent what? Slightly convexity, okay? We have a slightly convexity. It means straight, but not straight, okay? Because in the teeth, we don't have a straight line. You can add it with the carving if you want, yani. So make it convexity. Don't make any concavity here. Just keep it straight surface if you want, because I need it for the measurement from the medial aspect. So regarding to this contact area, you can see the slopes, the curvature, it will be equal from the labial to the lingual aspect. Keep it equal, please. Don't make any irregular surface here, because I need it for the correct measurement. Now, if I want to make evaluation, I think we had a width here, somehow width here. Just make adjustment to ensure the width, it will be correct. Not for the lingual, because we have a tapering in the lingual, but to perform a good measurement in this area. in the distal aspect or mesial aspect, as you prefer. So make a final checking to the all measurement online. This is the length of the crown. This is the minimum width here. This is the contact area. This is the tip of the cusp. We have a short slope toward the mesial. And we have a slightly convex here. Don't make it concave. Now what I need now? I need to assign the measurement from the distal aspect. So I think it is good now because we had all features regarding to the labial aspect. We had the contact area from the mesial, from the distal. We have a short slope, we have a long slope, we have a concavity here, we have a slightly convexity here. So we have a parallel surface from the mesial and the distal aspect. You can assign easily to assign the measurement of this area. Now I need to make, please you can remove this area to make the measurement visible, but please don't increase the length of the crown. I need this length only. Now please pay attention to this step. Now I will transfer my proportion, my thirds toward the other side. This is the cervical third. This is the cervical third. On the middle third, you don't need to make any line because we already had adjection, maximum coverage on this line. And it will be represent the incisor. So this is slope represent the incisor third, and it will be represent the middle third. So the middle third, it will be represent the maximum convexity to make a contact area, and we had the cervical third. What I need now to make a measurement to this aspect. So we finished this steps. I will convert it to make the another aspect regarding to the distal aspect or mesial aspect. We had this shape now. This is for canine. We have the maximum width that will represent the maximum convexity located at the cervical third. Let me check the measurement here. He said the labiolingual diameter of the whole crown 8 millimeter. Okay? And we had the labiolingual diameter at the cervical 7 millimeters. What does that mean? If you compared with the shape of the canine, I think all these measurements in the cervical third. That's right. This is the 5. This is the 7. And we had 7 and 8. This is the width of the what? This width. It will be represent the maximum width at the cervical. The other one, it will be represent the maximum width. It will be located in the cervical third. So we don't have more reference. We will assign this width, and we will depend it upon the shape because we have a length of the crown. So we had 3 dots if you want to make it. If you assign the minimum width here, and we will adopt the shape of the canine regarding to the tip of the block. Because we have a 10 millimeters here, just make a connection between 3 dots, but in accordance to the shape of the crown from the mesial or distal aspect. I mean from the proximal surface. Okay. So what's the meaning, the shape? Well, you can see the shape of the canine. It will be represented from starting from the 7 millimeters. That means we have a curve here because we will reach to the 8 millimeter. 7 to 8, it will represent the slopes, curve. And I will alter my convexity to what? To the tip of the crown. This is the tip of the crown. Regarding to the position of the tip, don't pay attention about that. We will make an edge, okay, and we will add the features. Regarding to the lingual surface, we have what? We have the concavity here, but not deep. Please pay attention, because in the canine, we have a two fossae. Yes, we have a lingual ridge. This is a new in our practice, okay? So this is a concave shape. Don't make it deep, because the lingual ridge, it will be not constructed if you make it deep, okay? Just make a slightly concave, not slightly concave, make it concave but not severe, and make a concave, a convex here to represent the cingulum. It will be reached at 7 millimeters, and to make it connected with the 8 millimeters and connected with the 7 millimeters. Where is the curvature? We have a curvature here toward the tip of the cusp. This is the curve, this is the maximum width. So I will assign 4 or 2 measurement regarding to the maximum width. It will be located, unfortunately, it will be located as a cervical third. And we will assign the shape and connect the outline of the shape regarding to the 3 measurement. You can assign only 2 within the top, and you can make auxiliary measurement, addition measurement at this area. My recommendation, make it all 4 measurement to perform a good curve here, okay? Let's to make a practice now. This is my camera now. This is the labial, this is the lingual, this is the distal, no any difference. This is my third, this is the one, yes. This is the my incisal third, this is the middle third, this is the incisal third. So I need what? 7 millimeters, that's right. Before that, to make a bisecting line. This is the bisecting line. But please don't increase the length of the crown. It is just for the camera, I will release this area. Okay. This is bisecting line now. What I need? 7 millimeters at the cervical to represent the minimum width. That's right. So our objective to assign the minimum width, maximum width, and we'll assign the addition of the outline of the. I need to make outline to draw, to assign the outline in the block. This is our objective. Okay. To make a carving according to the cutback technique. So I need 7 millimeters, means 3.5, that's right? Yes, make it 3.5. This is 1, 2, 3.5 for each side, that's right? Because I had a bisecting line. The first one, it will be located here. Sorry about this conflict. It will be represented here. And the other one, it will represent here. So what about the other measurement? 8 millimeters, that's right? Yes, maximum width. But unfortunately, it will be located in the cervical there. There is no other reference in the middle portion or the incisal portion. But you need to make a measurement to this line. My recommendation, make it. But if you want, just add 1 millimeters. Don't make another measurement, because we need 4 to each side. Just keep it in the cervical portion. Yes, this is within the cervical line, okay, toward the cemento-animal junction. The other one, it will be located here, 1 millimeter, just. If you want, don't make another measurement, just increase it 1 millimeters. Okay, the maximum width from the labiolingual, it will be located in the canine. Okay, it's we had a huge width here. Okay, it needs to be make a management. Okay, so this is my lines. This is the first dot, and this is the another. It will be located here. That means we have a curve Now, I will assign the curvature. I will assign the convexity. I will assign the convexity. Okay? I will assign the convexity from the labial margin. This is the labial. What we have in the labial, we will start from the 6 millimeter, from the 7 millimeter to reach to the what? To reach to the 8, yes, that's right. And we will connect it to what? To the top of the crown. But please, the maximum convexity, it will be located at this portion. Pay attention to that. So when exceed the 8 millimeter, start to make a curve. Or you are responsible about the maximum convexity, it will be clarified in the final carving. This is up to you. I mean, when I start, let's make a check. Yes, I will start from the 7 to 8. I start with the curve to the tip of the crown. Don't pay attention about this area because you already make a slopes. There is no edge. There is no tip of the cast. We have edge within this tip of the cast. Just we will make a one line to perform that. If you want to make it within the measurement, up to you. So this is the labial aspect. That's right. So this is the outline of the labial aspect. Okay, I will make this cutting to represent the labial aspect. Okay, from the, to represent the labial outline from the mesial aspect. So regarding to the lingual aspect, make a check to the line. Just make a cleaning here. Make a revision. This is the 6, this is the 7, this is the 8. We will start from the 7 to 8 and make a curve toward the tip of the cusp. So regarding to what? Regarding to the lingual aspect. This is the lingual. I need to make a curve here from the 7 to the 8. And this is the bulgy area, the maximum width. It will be produced what? You can see it will be produced the cingulum here. Okay, a huge cingulum. This is where this is a navigation for me. Okay. You can see this is the curve, represent the curve of the labial aspect, and we had the cingulum here. So you can see we'll start with the curve, but please, the lingual ridge, don't make it severely concave because you have a lingual ridge here. Just keep a slightly concave and make a connection to the tip of the crown. Here you can make a slopes. This is the slopes. Okay, it will represent this edge. This edge. You can see this slope. When I make a cutting, this is slopes. It will be connect within the concave here, and to reach to this maximum convexity, we represent here the cingulum, and to reach the 7. I start from the 7. This is the 7. This is the 8. The maximum convexity represents the cingulum. So I'll start to make a concave. Don't make it severe. To make a connect within these slopes until to reach the tip of the cusp. What I need to know to make a cutting. But don't make a cutting. Please make a double check for all outline. Okay. After that, make a cutting. So I need to make a cutting now, but please, I need to make a support. Please don't use this sharp edge. You can make it with a lacron. For the time, I will make a severe slicing. For you, make a gentle slicing. But to preserve the time, I will use these tools now. This is not a dental tool. This is for clay, I think. Just keep cutting regarding to the shape because I want to perform this shape from the medial aspect or distal aspect, there is no any different about this information. Just keep cutting and make outline of the canine. The outline of the canine is very essential. Why? It's had a same principle regarding to the labial aspect to the premolars, because when I had a good knowledge of the make a carving of two face, not one face, as in central or lateral, so this it will be facilitated my practice in the posterior teeth regarding to what? Regarding to the premolars. So this tooth, it would have two faces, one in the anterior teeth, another one it will be located on in the posterior. That mean we had an inclination in the labial ridge. Okay, so we had attractive feature or a good anatomical advanced landmarks in this in the canine. The canine is very substantial tooth, substantial shape. It will impact the smile. It will impact the orthodontic principle. It will represent the canine relationship in the class 1 relationship. So the canine had to need a special care to have a good practice or a deep understanding to be performed. Okay. To implement this shape, I will make a cutting now. I will make a cutting now to represent the labial aspect according to the shape. If you want to leave 0.5 millimeters for carving, up to you. But I don't need it. I will remove it. But please, you can see this curve. I need the maximum convexity in this portion. So just keep not roundation. I mean the cutting, okay? To represent the cutting, I need it in this aspect. What I need now, please. This is the 8 millimeters here, okay? That means this aspect had a maximum convexity. That's right? So please keep it. I need it because I will need it to assign this area. You can see this is the maximum convexity located to make a labial ridge. So this ridge, it had inclination. Just keep it. Please don't remove it. Okay? Because this is the maximum width from this aspect. I needed to make just labial ridge. We had a depression here. We had a depression here. Okay? So this area is for the central lateral is very substantial to make a labial ridge, but in the canine it needed. Okay, because why? Because I want to make two face. Okay, the face regarding to the anterior teeth, the other one to the posterior teeth. You can see the initial steps. When you had incorrect practice, it will be impact the further one. So just keep it with a gentle slicing within the measurement. If you want to make it with the freehand without measurement, up to you. But can you make this management to these features? Because I need to add these features. So this is the cutback. I will remove the wax. If I had a waxing, there's very visible to make if I had to make a correction or anything. But in cutback technique, I cannot add the features. I cannot add it if I had a not sufficient amount of wax. So this is the severe curvature. And I will make a correction. This is the maximum convexity here. Be sure it's not worth it to mention that we had 0.5 millimeters regarding to the original measurement, there is no any issue about that because I need it for demonstration, I need it for roundation. So, but please, in this area, we have 7 and 8 millimeter. Let's start to make it. Please make a good curve here to represent the curvature, initial curvature from the cement to animal objection. Now keep going to make another cutting, but please make support. So I need to make a cutting here on the cingulum area. Pay attention to this portion, please. Pay attention to this portion because I needed to make a bulgy cingulum here. Okay? Pay attention because when I make a severe cutting, this cingulum, it will be not produced in this area. So please pay attention to this area because we have a line, we have a mark here. You can follow this outline and make a cutting. Please don't make it straight according to the outline, according to the drawing. You can make a cutting with visible way because you had a guide. So in the canine, we will make a slicing. Please keep support to avoid fracture at the neck of the tooth. So my recommendation, don't make any feature regarding to the root now. Please make a final clinical crown. After that, start to be thinking about the root. There is incorrect approach to make a roots within the crown. Regarding to the dental technology, the focusing about the crown is more reliable and durable for your practice. So I think I need to make a slicing with the carver to avoid a mistake. So you can see this width in the top. Just I keep the tip of the, removing it from the tip aspect, okay? Just you can add the slopes here, but not now, I don't need it. So please don't make a deep fossa now, because we have a carving here, okay? Because we have two fossa here, we have a lingual ridge here, we have not very thick, but it seems thick marginal ridge here to connect it with the contact area. Just keep going to make a concave shape now. Make a cleaning to clarify the aspect, the site of your work. Now I can make now the maximum width or the high convexity here, the maximum convexity according to the line. This is the critical steps to perform the final shape of the cingulum here to from the distal side toward the mesial side. Okay, so just keep going to make this prominent area. This is very essential to make a cingulum. So keep going to make this curvature according to the measurement and the outline and the drawing line. I think I had a final shape, not final shape, the good outline for canine now, because we have a 10 millimeters only. Now it seems very short, but no, when I added the features, when I added the labial margin, it will seem very length. Okay, don't increase the length of the canine. Okay, the illusion or the features you added, it will affect the length of the crown. Okay, if you need to decrease the shape of the anything, make it round. If you want to make anything big, make it with angle. If you want to make anything within the to be length, make a parallel line with the straight line. So the features or adding features, it will be affect the shape of what? Of the objective. Of the object. Sorry. Now I think this is the final shape. Where is the tip of the cingulum regarding to the regarding to the canine. Where is the tip of the cingulum? In the center or in inclination? Or it had an inclination? What? In the center. That's right, or what? Huh? In the center or what? Center. Just in the lateral we have, or just in the central we have. Why? Because this is the first tooth to start with the curve. Okay? So make a check to the final outline. I think just keep getting regarding to the shape. Thank you for attention. Thumbs up. We are constructed outline of the maxillary upper canine. So before roundation, we had the result of the outline. So this is very essential stage to ensure that the foundation of the final shape of the canine, it will be performed accurately. Why? Because I have the base of the shape regarding to the canine. Because our outline cut it by the fundamentals and the principles in accordance to the cutback technique theory. So before making a roundation, please be sure the measurement, it will be correct after cutting. So in the cervical third, from the labial aspect, mesiodistal, it will be what? 6 millimeter or 5? 5.5, you can make it 6, that's right? So make check that the measurement at the cervical third, it should be result in 6 millimeter. Okay, you can put it 0.5. It will be removed by roundation. For the whole crown, we have what? 7.5 or 8? 7.5. We will make it 8. Yes. 6, 7, 8. So it will be the whole of the crown. You can see this is the axis. It should be removed. If you want to leave it, or you will start to make accurate measurement at this stage. Okay? So I will make adjustment to the measurement because I need about 9 millimeter width of what? 9 millimeter of what? Of the mesiodistal width of the whole crown. So this is the 8 millimeter. Okay? You can make it 8.5. But be sure it will be removed within the roundation, within the carving. So I need 8 millimeters. So I will adjust my cutting here to leave 8.5. Why I leave 8.5? For that reason, I want to make the line, the angle line within the distal aspect or mesial aspect to avoid make a mistake. Okay, so when I make a line here, angle line regarding to the box of labial aspect, I need this 0.5. Okay, it will be result ultimately within the 8 millimeter. Okay, so put it in your mind, this measurement is not for this is not for exactly make up. It's regarding to the proportion of the canine. Okay, to grant a natural outline of canine. Okay, or exactly it will be performed for a contact area, maximum convexity, maximum coverage. It will be create the accurate contact area in this area. Okay, so this is my measurement. I will make a double check for the measurement in the labial aspect. So regarding to the distal aspect, I need to make a double check to the measurement. So I need what? I need 5.5 for what? For the cervical third. You can make it 6, exactly 6. For the whole crown, I need what? 7? 8. 7.5. I make it 8. I have 1 millimeter axis. So you can make a removing but the maximum convexity, it will be remain in the cervical third. So you can see my ball gauge is now accurately seated in this measurement. So this is the axis of wax. I will remove it from this aspect to produce a proper measurement regarding to what? To mesiodistal width, labiolingual width, sorry. After that, I will make a checking to the outline of the canine. If I have X's or an even cutting, I need a straight line regarding to this measurement, because this will represent the fossa. I need to make a lingual ridge here. Okay, I need to make a two fossa, but this fossa it will include another ridge. Be attention about that. Pay attention about that. So to the cingulum, I will make a final check to the prominence of the cingulum according to what? According to the measurement. So the slopes, this is the distal slopes. I have another slopes in the mesial. It will be shorter than the distal slopes. I will pay attention to the curvature here, because this curvature I need it. I don't remove any axis from this curvature. After that, don't make a roundation. Please pay attention to all these features, because our aspiration to grant accurate outline for the upper canine. So this is my final check now. You can now make a roundation. Before that, make a semi-cutting here to provide a good profile for carving, but please don't make any thin area regarding to the root. Instead of that, just make a cutting in the block for the lacron to add axis for carving. But don't make any root shape now, because I will remove all axes of wax. I will perform the final shape of a crown. When I reach to the cemento animal junction, I will make a final shape of the canine. So this is my cervical line. Don't exceed it, please. Don't remove any area from here, because I need it in the root in the further stage. Just make a good sight or a good view for carving, to avoid breaking in the carving. So what can I do now after the final checking to the canine? What's my job? Make a cutting or roundation? Why I need to make a cutting here in the labial aspect to make a roundation, as in the slide, you can see it. So I am start with the roundation according to the maximum convexity. What's the condition with the roundation? I have a condition. I need to preserve the maximum convexity in this area. When I had a height of contour, it will be remain. Okay. So I will start with the roundation. I will start with the roundation now. So please make a roundation. Don't be fair about that task. Why? Because I'm already had the maximum convexity here. This is a maximum convexity to represent the contact area here. Just make a roundation. I'll make a zooming. Just make a roundation here. But please, when I make a roundation here, preserve the maximum convexity in this area. And don't make any groove now. Don't make any groove. Don't make any labial ridge now. Just make the angle line. You can remember we have 0.5 here. You can make a roundation within the angle line to perform the angle line now, to assign the box of the labial aspect. Please make it with the scientific rules. This is a science. This is not a skill to make a roundation. I have the maximum convexity. I have a contact area. So don't make it severe in this area, because I need to make it a good curve here in the cervical third. Because the canine, you can see here, we have this area it will be very curved toward the root, okay? So don't remove any excess, because I need to make a labial ridge here, I need to make a bulgy area here. Just make a roundation, but preserves the amount of wax to make this feature. Because our objective to make cutback technique to perform the shape. So enough. Don't make any roundation here. Just the line, it will be not appear. In this area, make another roundation so you can see the maximum convexity here. It will represent the contact area. It will be maintained with the same position, because I will push to the distal aspect, because our contact area in the proximal area is not in the labial surface. So please make a roundation here and be sure there is no any damage to the contact area, because I will push to the distal aspect. So my roundation, it will be identifying the feature when I want to make a labial ridge and do depression fossa in the labial ridge, beside the labial ridge. So just push it the maximum convexity to the distal. But don't make it severe, please, because I need just to identify the feature now. Don't make any grooves now. Don't make any advanced feature now. Just make roundation. So this is the roundation. For me, if I come to the cervical third, there is a maximum convexity in the middle. You can see, please, don't make a full curve here in this area to whole aspect, because in the middle, I need to make a labial ridge. It will be inclined distally. So when make a removing in this area, be sure there is a prominent, it will be remind here, prominent area here. So this is the distal area. So I need to make a sufficient amount of wax regarding to the measurement in this area. So I need to make a curve here, and preserves the good convexity to present the labial ridge. So our concavity, it will be located here only. I will repeat it. I need to make a labial ridge here. Okay, this is the labial ridge. So the labial ridge, it will be inclined to distal. Okay? It will be inclined to distal. What I mean now, when make a curve here, don't make it to the all distal or this portion. Leave some wax here to represent this feature, to create this feature. This is a labial ridge toward distal. So after that, you are free to make a severe concavity, you can say, in the distal area, within the distal area. I mean the angle line. I will connect the labial aspect with the distal aspect. Okay? You are free to make a concavity here, especially in the distal area. But in this area, don't make any concavity, severe concavity. We had a slightly convexity. Okay? That means we need make a roundation, slightly roundation here. What? Sorry? No, this is not regarding the contact. I need to make this area now. Make a roundation. I will connect the labial aspect with the distal. So what I need now, make a roundation here. That's right? So in this area, this is a labial ridge. Don't make it severe. In this area, you can make it in the distal aspect. We have a concavity in the distal aspect. In the medial aspect, we have a slightly convexity, according to our drawing. So don't make it with the final shape. Just make outline of the cervical now. Just keep roundation to check where is the axis of wax. Because our cutting, it will be make initial process to make a final landmarks within this outline. So just remove the axis. When remove the axis, please leave the correct shape. That's our objective now. Don't make any advanced feature now. Don't make two fossa and labial. Leave it now. Because we have, why may we need to make more removing from the labial aspect. Okay, let's check the lingual aspect. What do you have in the lingual aspect? In the lingual aspect, I need to make a tapering here. Okay, but when I make tapering here, the maximum convexity, it will be located here. Okay, the cingulum, it represents the cingulum. So the center of the roundation, it will be start from here. That means this area, it will be what? It will be removed. It will be removed. But in the condition, you should leave a sufficient amount of wax to make a ridge here, marginal ridge in this area. In the condition, you should make leave a sufficient amount of wax in this area to make another marginal ridge. And I need centered fossa. Don't need make an inclination in this fossa, in this cingulum, sorry. So I need to preserve the good shape in the distal aspect. You can see the marginal ridge, it will be connected naturally with the bulgy contact area within the labial area. Okay? So when make a removing, put it in your mind, you must perform this criteria. This is our objective now. So in the same concept, when I removing it from this lingual aspect, I will make a roundation to connect the distal aspect, the proximal aspect within the lingual. I think is now enough to make removing. Let's check the another side. Now, in my objective, I will make a carving within the student level, because I'm not a creative one, I'm not expert. This is not demonstration for students. When I make a demonstration, I will make it with the students' criteria. You can see, just make a thinking when make a carving, okay? I need to make another cutting here. Just keep moving to make a removing from this area, but please make a double check to preserve two marginal ridge here within the cingulum. This is our condition, okay? So I think the two lines here is very clearly now. I will make another zoom for the whole camera. So this is, I need it for the marginal ridge. I need this area to make a fossa. So I think the lingual aspect need added feature now. Just I make adjustment here within the fossa. I will make a checking to the incisal aspect. You can see this area is very thick. Make a roundation within the lingual. Make a roundation within the lingual. Make another roundation within the lingual. And if you need to make removing here within the roundation to connect the labial and lingual within the proximal surface, you can see the contact area, it will be clearly identified with this movement. Connect the lingual within the labial. By what? It will be result in identify the proximal surface. The more advanced features in the proximal surface, I had the bulgy area here. It will be represent the contact. Don't remove it, because it will be impact the proportion of the canine. Please, it will be dependent upon the measurement. The bulgy area here, you can see it. This is the main feature of canine, okay? Because we have another face regarding to the posterior. This face, this portion, we have two faces in the canine. This faces, it will be connected with the posterior teeth. So please preserve that feature set, because it is a distal area, okay? Now make another roundation, but please, the center of roundation, it will be started. Yani you can make a removing start from this bulgy area, from this thickest portion of the distal portion, or the distal aspect. So regarding to the maximum concavity and maximum convexity, leave it now. Just make a connection between the labial and the lingual. Don't make any feature now, just make a roundation. If we don't have explanation and if we don't have any explanation to the students now, it will take only 5 minutes. But I will make with the explanation, with the level of the beginner for students, it needs time, but with a normal time, it needs just only 5 minutes to make a roundation. So leave it now, don't make advanced feature. You make it gradually, step by step. This is for distal aspect. Now I will start to the mesial aspect. What's the incorrect shape in the mesial aspect in your opinion now? You can see the two faces here. It will be not connected with the lingual. So now make another roundation here to connect the lingual aspect within the labial in accordance of the contact area. The contact area, it will be maintain the final shape of what? The final shape of the proximal surface. Don't pay attention to the level of the margin now regarding to the cemento-limal junction. Just keep going to make a rounded area now and connected the outline of the lingual aspect within the labial. You can see the box line, it will be clarified here. In this area, I need a marginal ridge here. It will be represent the cusp ridge here. I need two marginal ridge here. This is the shorter one because I have a contact area here. This is the longest one. I need to make a fossa here. The cingulum, it will be already created. And I need to make the lingual ridge here and two fossa. Make it like a paper. What do you need to prepare a sketch for drawing, for carving. You can see this is in this time that's spent. I don't made any feature. Just I will complete my outline. There is no groove, there is no cingulum, there is no lingual ridge. When putting these features in your mind within the outline, there is no way it will be had a mistake. Make it more visible. By what? By adding the outline, the proper shape. After that, in the further stage, I will put it the feature. The feature is very easy to put it. Okay? Cusp, triangular, any features. But the difficult one, when I put it in the incorrect shape, in improper shape. So, in my mind now, to be honest, I will work it with what? With the criteria of students. According to my theory, according to my practice, according to my measurement, I need to make a proper shape of canine. Because we have principles, we have criteria, main feature of canine. Don't pay attention about the advanced feature. The advanced feature is very, very easy. When you are put it the final shape of canine, you can add it easily. Where is the place of this advanced feature? Just put it. In which aspect? But now, the challenge to make outline of canine. So this is my final adjustment in the lingual surface. I will make a checking to what? Make a checking to the incisal aspect. What I need in the incisal aspect? I need the incisal ridge. That's right, within the slope. I make a zoom. I think it's very clarified in your camera hall now. But what I need in this ridge? I need to make a removing now? No, don't make any remove. Regarding to the tip, is the proper tip? You can make a comparison with the accomplished one. I need this tip, okay. One here. So this is easy to preserve this area because I need it for tip. I need this area for the marginal ridge. So I will make another check to the labial aspect. You can see we had a convexity here and we have a labial margin. The standard point, your parameters to make a convexity, your condition to preserve the labial ridge. Because we have a labial ridge, then we have a depression, developmental depression in this labial aspect. So if this convexity, it will be appropriate with the construction of the labial ridge, I think I need somehow of removing from this area. So you can remove it. But regarding what? Regarding to the labial ridge, not whole of the crown. So put it in your mind, you need to make a labial ridge here now. Make a curve toward the incisal. When you make the work stage by stage and connect all aspects together, now you can add the advanced features in correct position and with a proper position. Is this appropriate time to add the advanced feature now? In my opinion, no. Just keep going to make a final roundation because you must make evaluation from all aspects, from the incisal aspect as a paired view, top view, from the incisal, and when you can see this feature, you can add it, the advanced feature after a final evaluation. When make evaluation, I mean, when I make evaluation, let's make evaluation from the top of view. What's the criteria of evaluation? I need to make a labial ridge here. I need to make two fossa here. I need to make two faces here. The face, it will be within the anterior teeth, okay? And the face within the posterior teeth. Is that wax enough to perform these criteria, in your opinion? For the labial ridge, this is the good amount of wax to make a labial ridge, okay? On this area, two developmental groove, I needed two depression, shallow depression here. I will add it, okay? After that, the maximum convexity, it will be located here, within the labial ridge. So what's remain here? It's finished, finished. I will just add the two depression, the labial ridge, it will be automatically produced. You can see, please, when make a anatomy, when make a carving, make it visible with a normal way, okay? Don't take a stress, okay? Take it easy, okay? This is the science. This is not skull, okay? This is the science. That is added the color within the layering. This is the science because I want to make what's the difference between the translucent and transparent. The translucent, it will be pass all light. Transparent, it will be keep some light. Okay? So this is the sign. After that, blend it with your skull. Okay? Now leave it. I don't need to make another feature now. I will put it in I will rotate it flipped in the lingual area and just make a check. As you a teacher, as you a team leader, make a check to your work. What's the wrong here? What I need now here? What I need now? Fossa, two fossa here, okay? Yes, the first criteria, please. Make sure there is a sufficient amount of focus for lingual ridge. According to your opinion as a student, I have a good amount for lingual ridge here. So what I need, two fossa, it will be automatically produced. I have a good amount of wax to make a marginal ridge here. Yes or not? I think we have some excess of wax here. Now, for the labial ridge, for these slopes. I need to make a ridge. There is no slim area here. Okay, I need to make a ridge because when I create the fossa, the ridge it will be automatically produced. That's right. So you have a sufficient amount of wax to perform that? Yes, of course. For the cingulum, we already depended upon the measurement. Okay. So I think I have one mistake here. Not mistake. I'm postponing to the further stage. This is the mesial or distal? This is the distal. That's right. This is the this is the mesial. What's the criteria of the mesial area? Slightly convex. Okay? This is slightly convex. To the lingual, we have tapering toward the cingulum. That's right. So make a final tapering. The center of the cingulum, it will be clarified here. So what I need now to make the main initial curve within the cemento enamel junction. But my recommendation, don't make any feature of foot now. Just I will connect it with the cemento enamel junction. Why? Because I need to make a curve beneath the cingulum. Because I have 6 millimeter here. You can remember that. We have a 6 millimeter here. I will perform the roundation for 6 millimeter. Because I'm start to make a curving. The free gingiva, it will cover this area. And it will be reach here, free gingiva. Okay? The cemento enamel junction is not, when you make it, this is not clinical crown. You will make it within the features under the gingiva. The clinical crown, that crown, it will be identified by your eye, by your examination. Okay? So I need to make a curve to represent the initial curve that will start with the width of 6 millimeter. The width of the 7.5 millimeters, 7 millimeters, okay? The width of the cervical third, that's right. But here, we need add a distinct feature here. Because in the distal surface, what I need to make in distal surface? I need to make a concave here. Concave. Okay? So where is the distal? This is the distal. So start to make a concave within the roundation. I will connect the labial within the lingual on the same concept. In the proximal surface and within the concave shape. Don't make only the concave shape. It will be produced two line here. Make a final shaping. Connect the three aspects within the concavity. By roundation, yes, it's your job roundation. But roundation, please, according to the principle. Don't make severe. Why make a concave here? I need to identify this feature now. The bulgy area of the canine. Okay, it will be located here. So the concavity, it will be say that we have minimum width here and we have the maximum width here. We have what in the 7 millimeters width? 7? 7 or 6? 7 the cervical third? From the labial aspect, mesiodistal width. From the cervical third. 6? This is exactly تقريبا 6. 6 or 5.5? 6. Yes. 6 millimeter. This is the 6 millimeter, that's right? Okay. And what we need in the labial aspect now? 8 millimeters or 8.5? The original measurement, it will be what? 8 millimeters. We will increase only 0.5. The whole crown, it had 8.8 millimeters. You can make it 8.5. Okay, but our evaluation regarding to what? Regarding to the 0.5 just only. This is the تقريبا 8 millimeter. So I think had 0.5 0.5 fee. We will our agreement to put it to 0.5 for the saving the mistake. Okay. Yes. You can make another roundation to preserve that measurement. It's not problem to make 0.5. My objective to make a proportion of the canine. Okay. So you can see now until this moment there is no any feature will added here now. What's the problem? There is no problem. I will keep going to make a final shape within the roundation. Okay. No developmental groove, no labial ridge, no any features, no cingulum, no fauces. Just keep going to make a final outline within the roundation. Because these advanced features need to appropriate shape. I think at a bubbles here, you can make a adjustment within the molting. Okay, by molting here. I had air bubble here. So please make a final checking to add features. What's your opinion from the top view? Please make checking with me. I need to make a labial ridge here. 2 depressions. Is correct for this task? Tamam. And we need to make a maximum convexity in this area. I need to make an inclination of the an inclined labial ridge. Okay, I need it here. Okay, this is already good. From the distal aspect, what I need? Concavity here. That's right. And I need to preserve this contact area and push lingually to make a contact with the premolar. Okay? So it will be clearly identified when I make a depression here. Because this is another loops. This is a distal loops. يعني it will be individually prominent. Okay? We have 3 loops here. Okay? Distal, middle, mesial loop. The distal loop, it will be create individual features that will connect it with the posterior teeth. Is that correct? We have a concavity here. We have a good contact area here. And we have a long slopes for the distal aspect. That's right. There is no blame about that. Make another check to the mesial aspect. This is a slightly convexity. We have the contact area in what? In the incisal third. That's right. Or injection. Yes. Injection or incisal third. I forget it. Yes, the junction. Yes, but it's still in the toward the incisal third. Okay. So I need a contact area here within the lateral. Okay. So this is a slightly convexity here. You can say it's straight, but not straight. It's slightly convexity. Okay. We have a short slope here. So there is any blame about that? So from the top view, we need make a 2 ridge regarding to our slopes. We need a short slope, long slope. I think there is a sufficient works to make only slope ridge here. This is attrition slope, okay? Yani we will remove the mamilons within the slopes, okay? If you have a baby, we still have a mamilon. After abrasion, it will become a ridge. After that, it will be sloped by attrition. Okay? So I need it to make a slope bridge. It will be sufficient amount of wax to be perform this task. No blame about that. Good. From the lingual aspect, where is the mistake here? There is no mistake, please. There is no mistake in your anatomy. I need to add a feature. We will make evaluation to add this feature. That feature, please leave it for 1 minute. Adding feature need 50 seconds. The challenge, it should be put it a proper position. Okay? For the lingual aspect, what I need, there is no mistake. Okay, our agreement, there is no mistake. What I need to make do two labial margin. That's two lingual margin. That's right. The long one, the short one. There is any mistake here or deficiency? Sorry, deficiency. As we call it deficiency, not mistake. Don't put it in your mind. You are making a mistake. In anatomy, we make a carving. If you need to make addition or repeating, it's okay. It's okay. Yes, I will check it. I will make this bubble because this block is not original. So I need to add what? To add margins here. And I needed to make a cingulum here. It's already created. And the ridge slopes, it will be normally clarified. So please give me a permission to start within the adding feature. What's your opinion? You are responsible about that. Adding feature now? Need any adjustment? Want to make a double check? I want to make adding feature. Give me a permission to add a feature. Eh? From cervical third in the lingual aspect? She said from the cervical third, from the lingual aspect, we need to remove what? From the cingulum area? Yes. To provide a tapering surfaces? Yeah. I will do it. There's no problem with that. Yes. I will do it. Just to make a tapering, because I will preserve the proportion of the canine. There is no other problem to add that. It's enough? Yes, because we have a concave shape, it will be follow this area. Okay? Any addition? Any addition, please? I will start to adding feature. It is not difficult to add a feature because I will, for the lingual surface, I will start from the lingual or labial, according to your opinion. Lingual, yes, lingual. What's the criteria to adding feature? I need two foci, okay? To perform, there is no any difficulty to adding feature. The difficulty is what? When adding feature, I need when added one, the other, it will be automatically produced. This is our condition. I need to add it. What? I need to make two foci. The objective is not two foci. The objective is to preserve the lingual ridge. So put it to your mind, when you are perform two foci, the labial ridge, it will be, lingual ridge, it will be automatically produced. So the challenge here, when make a carving, you must make one step, individual step. The further stage, it will be impacted with the initial one. Okay? What I mean now, when I make a two foci here, the labial ridge, it will be clearly identified. If you want to start with the two foci or with the labial ridge, this is one objective. The other objective, it will be what? The marginal ridge, it will be automatically produced. So the removing here, it is not difficult, but need to be accurate. Need to be a gentle removing. Need to be adding the idea, adding the concept of the foci. So I will start. Please make a support here. This is my fossa here. This is, I leave some amount of wax in this area, okay? Because I had a marginal ridge. Don't start from this area. Okay, this is one fossa. One fossa. Another one, it will be located here. We had big one and we had a small one. The another one it will be located here. So please, you can see now, the lingual ridge, it will be affected with the foci. That means my work is not, it is wrong. Please remove it, but keep the what? Keep the lingual ridge. The lingual ridge, it will be connected within the cingulum. So, ulterior technique, put it on your mind. When make a fossa, please preserve the marginal ridge, because your objective is not individually one fossa. When make a one fossa, it will impact the lingual ridge, it will impact the marginal ridge. Okay, this is what I mean. Why I postponing all features in the last stage? Because it will be a package, one package. It will be put it one package by one enter. Our enter now to make two foci. It should be automatically produce two marginal ridge, slope ridge, and lingual ridge. So please don't focus about one fossa, because you will remove the wax from another features that will need it to perform in the lingual area. So the mistake it will be, the deficiency it will be created in this stage. If you had a bubbles, if the wax is not original, you have a bubbles here, you can addressing by melting area to convert the properties of wax. So the fossa of the, we have a deep fossa in the lingual surface of canine. So our objective to make a lingual ridge now. Okay, the lingual ridge, it will be clarified. This is what I need now. So you can see when I make a fossa, the marginal ridge, it will be automatically produced here. This is the margin. We have a thick marginal ridge in the canine, as in lateral, thick marginal ridge. No. So the fossa, it should be what? It will be some persons say we need to make a double M here, but my concept don't use that. Use it with advanced thinking. I don't need to make M shape or EV shape, or this is not our concept in academic. We need to make a features. The feature, it will be connected with the others. Okay? So in my opinion, it's more easier to make it, because I will focusing about the M shape. I will make an M shape. There's no blame about this technique. But our focusing to make M shape in this area. No, don't fear. Don't be feared. Make a two foci, because your job to make two foci here and preserves two marginal ridge within the lingual ridge. Yes. In part, you need two foci, but not deep. In the lingual aspect, there is no deep fossa in the lingual aspect of canine. I need the lingual ridge. The lingual ridge, it will be connected with the cingulum. I need this ridge, the marginal ridge, long marginal ridge in the medial aspect and the short one in the distal aspect. So the slopes of the ridge of slope, it will be clearly rounded, but not thick. This is our objective in the lingual aspect. So the feature, it will be added as a package. When make a one, the another one, it will be connected. So in the summary, it will be added with the one package. When added one, the another one, it will be automatically produced. Regarding to the labial aspect, what I need, please answer me, what I need to add it in the labial aspect? Depressions? Yes. And what?
Labial ridge.
Labial ridge and depression. I will start with what?
Two depressions produced. Yes.
You can start with the labial ridge. You should take two depressions. So in the same please make it as a concept. When I put it due depressions, the labial ridge, it will be automatically produced with a neural shape.
Yes.
When I make a labial, when I make a labial ridge, okay, the two foci, the two developmental groove, it will be automatically with a normal shape, it will be produced. So make it as in package. One, it will be impact another one. But in this area, when I put it the labial ridge, I will make two faces. I will make two faces now. The face, it will be toward the posterior teeth, and the face toward the mesial aspect, toward anterior. I'm start to add, which one is long, which one is short, the depression, developmental depression. That's right, because I have a bulgy area here, and I have the long area here. So the depression, it should be clarified, not as in anterior, in the lateral and the distal. Because what? For what? Because I need to make an inclination of labial ridge. I need to make the labial ridge inclined distally. When make a ridge, the labial ridge, it will be inclined distally. Okay? After that, the face of the mesial aspect, it should be individually in creation regarding to what? In comparison with the distal aspect. So the labial ridge, it will be assigned the final shape of two faces. The labial ridge, it should be responsible upon two faces. I need one face here within the depressions, okay? In the mesial aspect, the labial margin, it should be clarified, had an inclination toward the distal. But which the fixed part of the labial ridge? In the cervical or in the labial? The maximum width of the labial ridge. There is no scientific word to answer it. It will be by thinking. I have a widest area here. I need to make a widest area in this aspect, in the incisal third. Because I had the thin one, the minimum width is toward the cervical third. Because it will be connected with the tip. So the final shape of the canine, it will be dependent upon the clarifying of labial ridge. But if you need to make adjustment to the labial ridge, you can add a more convexity here to make adjustment to the labial ridge to appropriate within the other parts. Okay, this is the labial ridge. Now we have a face regarding to what? Regarding to the distal aspect, and we have a face toward the anterior surface, and we have a labial ridge. It should be inclination toward the distal. So this is your criteria now. This is your criteria to perform these depressions within the labial aspect, within the labial ridge, to provide two individual aspects. But now you can add a developmental depression here, because why? There is two faces and we have another depressions. Yes, make it by scientific, by thinking. Why? Because we have three loops here. The connection of the loops, it will be no severe depression. But within the end session of the fusion of loops, it will be construct a depressions. So the depressions, it will be constructed in the top within the final fusion of loops. Okay, so I need depressions here and need another depressions here. But don't make it severe. I don't need advanced features now. So if you want to make advanced one, you added the notch. Where is the notch in the canine? I need 2 notches here, but my recommendation for me, don't make it for me, okay? After in the advanced stage, I will add it. Okay, I don't need it now, but I will make it for demonstration. You had a 2 notches here, okay? You had a smallest one here, and we have impressions lines. I will add it after that. Okay, our principles now, our objective to add a main anatomical landmarks. I need now the main. I will make a revision to the main landmarks I needed in our lab today. I need the labial margin here. I need 2 face within 2 depressions. It will represent the end diffusion of the loops. I need the tips to connect it with the labial margin and inclination to the distal. Okay. I need in the contact area with a rounded shape with the good surface, a broad surface. Don't make it a tip here. There's no tip with the contact area. I need a bulgy area here in the proper position. This is the distal. I need a concavity here. The severe concavity, it will be followed the lingual aspect. So I need slightly convex here regarding to the distal aspect. Okay. For the lingual surface, I need shallow depressions to represent 2 foci within the 1 labial lingual ridge. It is very, very mandatory to make it. That will connect it with the fossa. This is our objective in this lab. If you want to add advanced one, after smoothing, you can add it what? You can add it 2 notch here and 2 depressions here. But in the wax, I don't need it now. I will make it by veneer. I will make it by make a mimic to these natural features. But I don't need it in the natural dentition if I make a procedure to the patient. I will make a mimic with the adjacent teeth. Okay. So I will add it if you want to make advanced one, but don't need it in this lab. You can add it impressions here, lines. Okay, and we have another lines within the I need within in the long axis and the horizontal axis. Okay, 2 axes. But after that, after smoothing, it will be mimic the natural teeth, but within the build-up, it will be accurately clarified after glazing. Okay. What's the benefit of these lines, impressions lines, these lines? What's the benefit? It will be substantially assist the reflection of light. When you add it, if you need it, it will be when the light will impose the teeth, the light, it will be absorbed and reflected. The dark one, it will be absorbed. The translucent, the another one, it will be reflected. So it will be make a reflections, make a variation in the light. So the light, it's responsible to produce the normal chroma, or no, normal shade, sorry, for the tooth. Okay? If there is no light, there is no shade. If there is a light, there is a shade. If we have a focusing the light, according to the type of the light, we will produce the actual shade. So the impression, it will be assessed for these principles. Okay? The labial aspect, the main feature in the labial aspect. This is a labial ridge. It will be inclined toward what? Toward distal, you can see. Yes. Okay. And others, what we have? And we have a central labial ridge, and we have. Now we're still in the labial aspect. Yes, we have slopes, but we have 2 developmental groove, but shallow, but is more than the lateral and central, and we have 2 surfaces. This is the main aspect. We have surfaces that toward the anterior teeth, and we have another surface toward the posterior teeth. That's right. So regardless of the labial margin, we have two surfaces, and we have in each surface we have a shallow depression. Okay, so you can see this is the labial margin. It will be divided, the labial aspect, in two surfaces. In addition, we have two depressions in the incisal aspect. Okay, but it will be not shallow as in central. It should be identified. Okay, we have a deep grooves here. Okay, we have a deep depressions here. Okay, so this is what I mean. We have a bulgy area in this area in the distal aspect to represent the maximum curvature at this distal aspect. So you can see the canine have two surfaces. The one of the distal aspect, it had a bulgy area here to represent the contact area. Okay, this is what I mean. So where is the maximum convexity of canine? Which third? In the cervical. But we still had the maximum convexity toward the incisal edge. Don't make it very careful, because we will make a labial margin, a labial ridge here. We still need a wax in this area, because the convexity, the curvature, it will be in these aspects, not in the labial ridge. What I mean, the maximum convexity at the measurement, it will be located as cervical. Okay, so we will still need to make a labial ridge in this area. Okay. Regarding to the removing of wax, it will be removed in these aspects, in these surfaces of the mesial and distal surfaces, regardless of the groove. Okay. So what we need in the lingual aspect, the main feature, two foci. That means we have a lingual ridge here. Okay. But these two foci, it's not deep. Don't make it deep. Instead of that, just identify the ridge, the marginal ridges here on the incisor ridge. When make a lingual aspect, when lingual ridge, we still need a wax to connect it with the cingulum, and we need to make two depressions to represent the two foci, two separated foci. We have a main fossa separated with the lingual ridge. So we had the marginal ridge, long one and short one. The short one, it should